BMESolutions, and we're presenting MedCurrent. Join us as we reimagine the limits of telehealth. Allow me to introduce my team. We are seniors in the University at Buffalo's Biomedical Engineering program. I'm Andrew Sullivan, and I worked with Bo Ibitayo and Samantha Seymour. We were presented with the challenge of accessibility to healthcare. Poor access to healthcare often causes a delay in the diagnosis and treatment of illnesses. We were tasked with developing a solution that utilizes telehealth and/or wearable technology to increase patients' accessibility to healthcare. We've created a novel solution, and we're excited to share it with you and give you some insight into our design process. We began by narrowing down the scope of our problem. A major component that impacts patients' access to healthcare is appointment wait times. A 2017 study reported that the average wait time for new patients in large cities was about 24 days. And for new patients in medium-sized cities, it was 32 days. While long wait times are annoying, their impact reaches far beyond that. CEO Tom Cox of My Health Direct warns that long wait times often lead to the use of emergency room services for non-emergencies, and increased incidence of patient no-shows, and of course, emotional and physical burden on the patients. So we wondered, how might we streamline the physician finding and appointment booking process so that we can reduce wait times for appointments and increase access to healthcare?
Once we identified the problem, we began to design the solution. We started by asking questions to understand the limitations of the current system. Why don't patients currently shop around for the earliest appointment available? Why do patients have to call offices and be put on hold or be transferred before they can book an appointment? It turns out that patients would have to call every individual office and ask for the availability before finding the earliest option, and this is just not feasible. We then began to ask what ifs. What if a patient could be more in control of the appointment booking process? What if telehealth could be used to optimize physician capacity so more patients could be seen in the same amount of time? What if patients could view what physicians in their area had the earliest appointment without calling? To answer some of our questions, we conducted an interview with primary care physician Dr. Abdel Saeed at ECMC Hospital. We found out that although patients wait a while for their appointments, there tends to be a high number of no-shows. She was also in full support of telehealth, stating there is always merit in talking to a doctor. And with known symptoms, no medical history, and a conversation, patients can be diagnosed, called in for a follow-up, or be referred to a specialist. After collecting both primary and secondary research, we decided to create an app to address these issues. We created a concept schematic tree. It shows the step-by-step walkthrough of the user's experience. Keeping accessibility in mind, our aim was simplicity. We would start by signing in. From this, they could either access the account to view notifications and upcoming appointments, or they could schedule an appointment. During the latter process, the user can choose to express their symptoms, and this will help the system recommend a virtual or in-person appointment.
We then created a prototype to represent the user's experience. The middle screen shows the fourth step, where a visual representation of the human body is depicted, and the user can tap where they're experiencing symptoms. We chose to represent this diagnosis screen this way, since this method can be used by patients who don't have sufficient knowledge of medical terminology to be able to type in their symptoms. The app will then continue on with questions following their choice that aim to recommend a specialist for them. The patient can also bypass a section if they know a specialist their symptoms elicit the need for. For increased accessibility, we also have a speaker option that can read out each question. The last screen shows the fifth step and provides a list of relevant physicians in the area sorted by their soonest available appointment. Additional information like location and rating will be displayed so the user can make an informed decision. Choice of color is very important in the design process because particular colors can evoke certain emotions. After some research, we ended up narrowing down the color choice to blue and pinks, because we found that the color blue conveys relaxation and high concentration, while the color pink represents renewed health and vibrancy.
Take Lori, for example. Lori has recently started experiencing persistent headaches. She calls her primary care physician and books the soonest appointment, which is in 15 days. At this appointment, her doctor refers her to a neurologist. She calls the neurologist's office to discover that the next available opening is in 30 days. When her appointment with the neurologist finally rolls around, Lori has now suffered for over a month. If Lori had used MedCurrent, the software would have suggested that, based on her symptoms, this issue could be discussed with her PCP via a telehealth appointment, which could have been scheduled for the very next day. MedCurrent also might have registered a cancellation at the neurologist in real time and would have notified Lori right away, allowing her to book that appointment 3 weeks earlier. MedCurrent is an app that improves accessibility to healthcare by reducing wait times for healthcare appointments through optimizing the patient's appointment booking process. So why does MedCurrent work? Well, wait times are reduced by presenting users with appointment options across physician practices. This replaces the need for patients to personally contact different offices to check their availability. MedCurrent does the shopping around for the soonest openings for you. This means patients will see availability of physicians they may not have even thought to call. MedCurrent also analyzes your reported symptoms and determines whether a telehealth visit is an option for you, which may help you get seen by a physician sooner. Finally, MedCurrent provides real-time updates of availability so that canceled slots can be filled.
Some key steps in our implementation process would include creating a voluntary clinical network that would have the participating practices sync their calendars to the software. Patients would then be able to launch the MedCurrent app and view appointment availability across all the physicians that participate in the network. The MedCurrent platform would be accessible to those without smartphones as well by implementing tablet access in local pharmacies. We also plan to continuously evaluate the satisfaction of the patients through a survey that would give feedback to help us keep up with our customer demands.
In non-emergency situations, people should still have access to immediate healthcare, and MedCurrent is the way to make efficient healthcare accessible to all.